welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. In our series of transplants, today we discuss kidney transplants. The kidney is the most transplanted organ worldwide, followed by the liver and the heart. Ahead of the show, we try to understand how the kidneys are innate to the human body and what happens when these bean-shaped organs malfunction, leading to complexities. I'm your host, Preeti. Kidneys, one of the most vital organs in our body, work silently, keeping us alive by filtering the waste and maintaining balance. But what happens when they fail? Chronic kidney disease is a growing health crisis, often detected too late. World Kidney Day 2025 takes place on March 13th with the theme, Are Your Kidneys OK? Detect Early, Protect Kidney Health. The campaign stresses on the importance of early detection and the intervention in preventing kidney diseases. We will take an in-depth look at kidney function, the dangers of kidney disease, and the roads to recovery through dialysis and transplantation. From the financial burden to the donor shortage, we uncover the realities of kidney health in India. Here's a report by DD India's Harshita Oberoi.
The human body relies on the kidneys to filter waste, balance fluids, regulate blood pressure, and produce essential hormones. Every drop of blood in our body passes through them, ensuring toxins are flushed out through urine. But when these vital organs fail, the body begins to suffer. Chronic kidney disease is a silent killer affecting millions worldwide. In India, the numbers are rising at an alarming rate. The most common causes diabetes and high blood pressure. But lifestyle factors such as obesity, smoking, excessive painkiller use, and genetic conditions can lead to kidney damage. The warning signs often go unnoticed: fatigue, swelling, loss of appetite, changes in urination, and high blood pressure. Many only realize the damage when it's too late. Early detection can be life saving. Routine blood and urine tests, along with imaging scans, help doctors identify kidney diseases before it worsens. But what happens when kidney function deteriorates beyond repair? For many, dialysis becomes the only way to survive. This process mimics kidney function, filtering toxins from the blood. But dialysis is not a cure, it's only a temporary solution. A kidney transplant offers the best chance at a normal life. A healthy kidney, either from a living or deceased donor, is placed into the patient's body to take over lost functions. When kidney fails, a transplant offers hope. A healthy kidney is placed in the recipient's lower abdomen, connected to blood vessels and the bladder. Damaged kidneys usually remain unless removal is necessary. A perfect match is crucial for survival. Blood type, tissue compatibility, and antibody tests determine success. Screening for infections and kidney function ensures both donor and recipient are fit for surgery. Relatives often step forward as living donors, but approval is required for unrelated donors. Deceased donor kidneys retrieved from brain dead patients offer another chance, but shortages leave many waiting. Hope lies in registries like Noto, where patients await a match. Paired kidney exchanges help incompatible donors swap kidneys, saving lives. But for thousands, the wait is a race against time. Not everyone qualifies for a transplant. Patients with end stage kidney failure, severe infections, or genetic disorders like polycystic kidney disease may require a new kidney to survive. But transplantation comes with risks: organ rejection, infections, and lifelong immunosuppressive drugs. Ethical concerns also surround the process, with illegal organ trade still a harsh reality. Beyond medical risks, the financial burden is overwhelming. A kidney transplant in India costs 5 lakh to 10 lakh rupees, with post surgery care adding to the expenses. For many, this life saving treatment remains out of reach. For those who do receive a transplant, life changes forever. Regular checkups, strict medication schedules, and lifestyle modifications become part of daily life. But with care, many go on to live healthy, fulfilling lives. India performed over 13,000 kidney transplants in 2023, according to Noto. While the numbers are growing, they fall far short of the demand. Thousands still wait for a donor, sometimes in vain. The biggest challenge? A severe shortage of donors. While living donors play a crucial role, deceased donor transplants remain low due to lack of awareness and complex legal processes. The gap between demand and supply continues to cost lives. Prevention, however, is in our hands. A healthy lifestyle, regular medical checkups, staying hydrated, and managing conditions like diabetes and hypertension can protect kidney health.
Kidney disease may be silent, but awareness can give it a voice. As medical advancements continue, increasing organ donation and making transplants accessible to all is the biggest challenge and our greatest hope. Harshita Obroy, reporting for Wellness Watch, DD India.
All right, so a kidney transplant is a surgery to place a healthy kidney from a living or a deceased donor into a person whose kidneys no longer function properly. End-stage renal disease occurs when the kidneys have lost about 90% of their ability to function normally. People with end-stage renal disease need to have waste removed from their bloodstream via a machine, that is dialysis, or a kidney transplant to stay alive. Kidney transplantation is performed to prolong and improve the lives of those with end-stage renal disease, and open and laparoscopic surgery are the two approaches for both procurement and transplantation. Today in Wellness Watch, we ask the following questions. What is a kidney transplant? Is a kidney transplant better than dialysis? What are the types of kidney transplants? What are the risks of kidney transplant? And what medical advancements have been made in India? India has become a preferred destination for kidney transplant surgery. There are around 600 kidney transplant centers, and out of these, 75 are in the public sector and the rest in the private sector. India offers a blend of world-class medical facilities, high-skilled surgeons, and cost-effective care. Up on your screens, we'll get you hospitals and institutes which provide services when we talk of kidney transplant. All India Institute of Medical Sciences, Delhi; Sawai Man Singh Hospital, Jaipur, Rajasthan; Indira Gandhi Institute of Medical Sciences, Patna, Bihar; Ram Manohar Lohia Hospital, Delhi. All right, to help us understand the role of kidneys in the human body and the complexities if these kidneys malfunction, and also to help us understand kidney transplant better, we are joined in by guests in the studio. We're joined in by Dr. V. Seenu. He's former professor and head general surgery and kidney transplantation, AIIMS, New Delhi. And we're also joined in by Dr. Sandeep Mahajan, professor, Department of Nephrology, AIIMS. Welcome both of you. Hello. And to begin with, I would ask Dr. Seenu to help our viewers understand, though we've shown a detailed report telling them about kidney transplant, but in very common, simple layman terms, what are kidney transplant and why is a kidney transplant better than dialysis, if it is so?
Yeah. Basically, as has been told in the report before, it is that in kidney transplant, what happens is that the person's both kidneys have failed and more than 90% of the kidney function is lost. Under such circumstances, the body is not able to get rid of all the waste, and also kidney has other functions in relation to the body, such as maintaining bone health and maintaining the hemoglobin in the body and the other functions. So all these functions are provided only by kidney transplant, not dialysis. That's why kidney transplant is much better than hemodialysis in the long run. Now, what is kidney transplant is nothing but you actually retrieve or procure a kidney either from a live related donor or a deceased donor and transplant it in the patient, and the kidney starts working in the patient. That is what is kidney transplant.
All right, a live or a deceased donor, we take a kidney and that is called a kidney transplant. But Dr. Mahajan, what is preemptive kidney transplant and what are the risks associated on the whole with kidney transplants?
Okay, so by meaning the term preemptive renal transplant is, once we plan a patient for renal transplant, when he is not requiring dialysis. So usually by the time, as you said, 90% of the kidney function goes down, this is the stage when he requires dialysis or transplant. But we know that chronic kidney disease is a progressive disease. So in case a person has a donor, he is not keeping well while on medicines alone. He is a young child who has to grow, or he has to attend school. So in that scenario, you can think in terms of a preemptive transplant. That is, the patient would go ahead with the transplant without transitioning into dialysis. So this, as I said, offers certain advantages, and it will give you a better quality of life and a better lifestyle. This would be especially relevant in a young child because he has to grow, he has to go to school, or in a very active guy who would be otherwise burdened by going to dialysis 3 times a week or 2 times a week to get that dialysis done. It obviously comes as a cost because a transplanted kidney is not for a lifetime. On an average, a transplanted kidney would survive or would function for around 9 years. Since the patient life of that kidney is only for 9-10 years and the patient is likely to survive longer, therefore a single kidney is not for a lifetime. So we actually are cutting down on that life of that kidney by doing a transplant early. Transplant comes with its own set of complications. As you said, they would be requiring drugs so that the body does not reject that organ, and these drugs are immunosuppressive drugs. So these drugs bring the immune system down, and then you are prone to multiple infections. These drugs also come with certain metabolic side effects. They make patients more prone for diabetes, hypertension, decreased bone health, and also increase susceptibility to cancer. So you have to balance the risk and the benefit. But as far as the quality of life is concerned, as far as the amount of therapy, life on therapy is concerned, transplant way outgoes the hemodialysis.
All right, Dr. Seenu, let's take that forward. Sir explained preemptive kidney disorder. But to begin with, what are the symptoms of chronic kidney disease for a person to understand that his kidneys are in danger? And after that, for how long, or for that matter, in a lifetime, in a human lifetime, how many times can a person undergo kidney transplants?
See, the irony about chronic kidney disease is very often there are no symptoms by which it can manifest. The symptoms may be very vague, like fatigue, weight loss, not feeling well, sudden development hypertension, diabetes deteriorating or diabetes becoming better on insulin. So there is no specific symptom. What is more important is one has.
Then we should see a doctor then?
Yeah. So there are some criteria, like if somebody is a hypertensive or a diabetic, then you have to undergo routine annual screening with urine protein and some such thing. Otherwise there are no specific symptoms, but more important is that those who have hypertension and diabetes, they should be under regular monitoring with a doctor and adopt good lifestyle measures.
And how many times can a person undergo transplants?
See, theoretically it can be as many times as possible, because as Professor Mahajan has said already, that the lifetime of a kidney is only 9 years. Suppose you transplant somebody at the age of 12 or 15 years, he will need another kidney.
Yes.
So in institute we have done maximum 3 transplants in a single person, but it can theoretically be as many times as possible.
All right, Dr. Mahajan, help us understand what are the risks associated with kidney transplant, and also how common are kidney transplants today?
Well, you did say that last year we did around 6,000 kidney transplants all over India. So, but you see, it's just a small fraction of the total patients who require kidney transplant. Every year, just to put things in perspective, every year around 1.5 lakh patients all over India would be requiring dialysis. Of these, only 6,000 have been transplanted. So it's a huge number, and we are just trying to fill in whatever we can. So kidney transplant is a very, for medical terms, it has been there for quite a long period of time. It's a very well established procedure. It's routinely done. As you said, in India we would have more than 70 centers doing that, more than 600 centers doing that. So it's a very common surgery. It's a surgery which can be easily performed. The problem obviously comes in improving the outcomes of kidney transplant. So there are few issues which I told you. One, a kidney is not there for a lifetime. So one challenge or one risk is to increase the lifetime of the kidney to as long as possible. The second challenge is to prevent the patient from getting various complications which I just highlighted. So that would be various infections which could be due to immunosuppressive drugs.
Okay.
To prevent metabolic diseases which can happen because of the drugs, because steroids are used very often in almost all the regimes of kidney transplant, and they are associated with diabetes, hypertension, bone ill health. So that would be another challenge. And number two, to have downstream effect of immunosuppression, that would be increased chances of cancer, besides repeated infections. So these are the important complications of kidney transplant and the important challenges which we face while doing a kidney transplant.
Okay. Dr. Seenu, when a person undergoes a kidney transplant, what happens to the kidney that was malfunctioning? Is it removed?
No, see, normally you don't remove the native kidneys. The native kidneys stay in the patient unless there are some specific indications. Suppose, as was told in the report, if there is a bilateral polycystic kidney and in one of the kidneys there is bleeding happening or it is causing pain, or the kidney is so big that I am not able to put a new kidney, only under that circumstance you remove. Otherwise the native kidneys do stay in the patient. They may not function, but you do not normally remove them.
All right, Dr. Mahajan, what medical advancements have been made in India when you talk of kidney transplant?
Well, as I said, renal transplant is not a new thing. It's been happening for ages. Importantly, over the last decade, lot many barriers have been broken. So we have, initially we could not transplant across the blood group. We had to have a compatible blood group to do a kidney transplant. But for more than a decade now, all of us are routinely doing kidney transplants across the blood group. It might be more expensive, it might be more challenging, but it's very well done, and it's working very well. So kidney transplants across the blood group, that increases the donor pool. So one thing which is limiting the live related program is the donor pool. You have nuclear families, you have smaller families, you have lesser number of relatives. Then kidney diseases tends to happen in the whole generation. You would have diabetes, hypertension happening in all the near and dear ones. So the donor pool is shrinking. So doing the the kidney transplants across the blood group actually is a huge improvement. Then transplants across a retroviral or patients who are suffering from HIV, AIDS. Initially they could not get a kidney transplant, but now they very well can get a kidney transplant. There have been more interest recently about doing a xenotransplant. A xenotransplant is when we have a kidney from a non-human source. So,
Pigs,
pigs is one such example. So, it has been in the line for quite some period of time. But in last 1 or 2 years, there has been a huge and very interesting developments in xenotransplantation as well. And I hope that someday it might see the light of the day. It's still done not as a routine in experimental protocols in few centers in US, but I do hope that it would see light of the day very soon.
Sir, would you add to it, the medical advancements that have been seen?
Yeah, and the other thing is making kidneys artificially in the laboratory and using them, the porcine kidneys, like you do genetic engineering and develop the kidneys and use. This is another new thing, and as Sandeep has said, that it may not be very far that xenotransplantation may come into the fore.
All right, Dr. Mahajan, you told us that a child as young as a school-going child can get a kidney transplant. But then is there, for the elderly people, is there any age limit, specific age bracket when a patient can get a kidney transplant done?
So there is no upper age limit for kidney transplant. We all see that we should be able to give patient a good quality and a sustainable life after kidney transplant. So if the patient is fit and healthy, he can very well undergo a kidney transplant. At Institute, we have done a kidney transplant in a patient who is more than 78 years old as well. So provided he is fit and healthy. So if the life expectancy of the patient or his survival, which is estimated, is less than a year, even if we remove his kidney disease, say he is having a terminal malignancy, a very severe cardiac condition, severe neurological deficit, then there is no point transplanting him. But if he is fit and healthy, there is no upper limit to the age at which he can get a transplant.
All right, a person has to be fit and healthy to get a transplant done. But then this brings me to the next question. Can there be any lifestyle changes that we can do in our day-to-day lives to protect our kidneys?
So obviously, and this has been the focus for all the World Kidney Days for so long. As I said, obviously we are far outstripping our ability to transplant and dialyse these patients than the number of patients we have. So omitting smoking, tobacco in any form, because that is very dangerous for the kidney. We all know it's bad for the heart, bad for the lungs, it causes cancer, but very few of us know that it also increases kidney diseases. Obesity is one lifestyle changes which is hugely impacting the kidney disease. It not only increases the chances of kidney disease, it also increases the rate of progression of kidney disease. Healthy lifestyle, decreased salt, less of tobacco, regular exercise, and management of weight. I think so these important lifestyle changes, if you implement, you can significantly slow the progression of kidney disease and also importantly prevent the kidney disease from happening.
Dr. Seenu, when we talk of kidney transplant, then 9 to 10 years is the limit for a person to live after kidney transplant. But then can a person actually survive on one kidney?
Yes, that is the sole purpose of doing a kidney transplant. Whenever we transplant in an adult, we transplant a single kidney only. So one kidney is enough for people to survive. And even when you see, there will be like some people who will be having a single kidney actually from birth, and they will be living their normal life. So one kidney is enough for the life of a person.
All right, so today in Wellness Watch, we are discussing kidney transplant, and we're joined in by guests in the studio. For the benefit of our viewers, we'll have a quick rapid fire round, a kind of Mythbuster round, wherein I'll ask you questions and you can clear the doubts. Dr. Seenu, you can't have a kidney transplant if you've been on dialysis for a long time. Is it true?
No. Though we try to reduce the number of dialysis events, but no, it is not.
Dr. Mahajan, you end up being weak after the transplant. Is it so?
No, you feel much better, both the donor as well as the recipient.
Dr. Seenu, transplants are convenient for healthy and younger people only.
No, not at all. It can be done at any age as long as a person is fit.
Dr. Mahajan, kidney donation is risky and the process is liable to harm the donor.
Well, we won't have 2 patients instead of 1. So we are very particular that the patient should be absolutely fit and healthy before donation, and donation in no way would impact his health or her health subsequent to
That brings me to the next question. Donating a kidney reduces the donor's life expectancy. Is it so, Dr. Seenu?
No, not at all, because there are people who have one kidney and they'll be living all their life without knowing that they have one kidney.
And surgery will affect the donor's ability to have children. Is it true, Dr. Mahajan?
No, not really. The only thing is you would have to be a bit more cautious, and you have to monitor your pregnancy a bit more closely rather than just to have it that way.
All right, so that brings us to the end of this discussion this afternoon on kidney transplant. Thank you so much, both of you, for joining us and throwing more light on the complexities the human body faces if the kidneys malfunction. Kidney disease and post-plantation patients can live a joyous, productive and fulfilling life. Healing at times cannot be linear and can be a long procedure, but be kind to yourself through it all. Mental wellness, self-love and acceptance is so important. On that note, we'll end this edition of Wellness Watch here. Till we meet next, take good care of yourselves.